Well, thank you very much. It's a great pleasure to be here, and I'm pleased to see that so many people are interested in vitamin D, and really I'm grateful to Rufus for really promoting vitamin D for health for people in the UK, because I think it is a very important issue. So I am going to be talking about vitamin D at the Lightful Vitamin. Hopefully I'll convince you of that by the end of this. Teaching goals will be: how do you diagnose vitamin D deficiency? What vitamin D metabolite do you want to order? And what are the non-calcemic benefits of vitamin D? Now, when Rufus asked me to do this, I was getting a little bit nervous because I realized that I had this varied audience with varied experience. And so how could I give this presentation? This is Cliff Rosen. He's a close friend of mine. He was on the IOM committee, and I will put some perspective, because we did a study with him in terms of what his conclusion is, but what in fact was published by him and us. So the Institute of Medicine met for 2 years, reviewed over 1,000 manuscripts, and came up with these recommendations. And these recommendations were basically made based on randomized controlled trials, which is what they consider to be the gold standard. And again, we'll put some perspective for this as well. People worry about who supports you. I get support from NIH and the UV Foundation, and I get a variety of companies that I consult for as well. But much to the dismay of the dermatology community, I also get support from the Sun. And for those that are interested, you can go to this website, drholick.com, for more information. Now, I've been talking about vitamin D for more than 30 years, and I tell you what, usually the audience would be like 1 or 2 people, because people could not think of a more boring subject than vitamin D. Found in cod liver oil, prevents rickets in kids. We don't see rickets commonly. We're not thinking about vitamin D deficiency. I don't know what she's thinking about, but what you should be thinking about: who is at risk? And I hope to convince you by the end of this that everyone is. He's worried about global warming, but you should worry about what is the big deal about vitamin D deficiency. Because really, rickets is the tip of the iceberg, because of painful bone disease, which I'll talk about more in a minute, diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension, heart disease, common cancers have all been associated with vitamin D deficiency. Now, you may wonder what I was smoking last night, but there's actually good science to back up all of these. In fact, Discover magazine in 2007, of the top 100 medical breakthroughs, number 8 came in: can vitamin D save your life? Time magazine in the same year picked it up and considered it more benefits of vitamin D, 10 biggest medical breakthroughs. So if you really want to impress your kids with what you do, though, you don't publish in Nature and Science. No. Fitness magazine, they had a 2-page spread on vitamin D. And if you want to get your teenagers' attention and impress them with what you're doing, there's only one place to publish: Teen Vogue. And in Teen Vogue was Sunny D. But what's the message here? This is the message. The docs actually haven't been getting it. It's been the lay press and the public. And often the patient will go to the physician, request a vitamin D level, a 25-hydroxy vitamin D level. The doc refuses. Patient persists. Doc finally gives in. Doc finds that, in fact, the patient's vitamin D deficient, and now orders on all their patients. Now the doc's got religion. In the United States, the assay for 25-hydroxy D is the most ordered assay. And if you can believe it, I just got back from Australia. 1 in 9 Australians now get a blood level of 25-hydroxy vitamin D. $80 million a year is being spent just on that assay alone. More than 40% of Australians are vitamin D deficient. So vitamin D is a sunshine vitamin. So whether you're amphibian, reptile, avian species, lower primate, we've always depended on sun for our vitamin D requirement. In fact, our skin pigment is perfectly designed for our environment. Now, I wondered about these dark-haired Neanderthals, how they could have survived in a northern European climate. And it turns out that their DNA has revealed that they were red-headed Celtic. In fact, the driver for evolution, for hypopigmentation, for why most of you have very little pigment is this a simple reason. Here is a pelvis of a normal female. This is a pelvis of a female that had rickets in utero and in the first few months of life. She would have had a difficult, if not impossible, time with childbirthing. So within a few generations, pigmentation had to have devolved in order for them to have made enough vitamin D. Now, in Boston, you can't make any vitamin D in the wintertime, so I thought we would go to Kenya. I took my daughter and go on safari, make some vitamin D, and write it off on your taxes as medical expense. That doesn't work, all right? But this Samburu warrior, his skin pigment is perfectly designed for living at the equator. So how do you really compare and contrast? So I figured, what the heck? There's no question that my gene pigment devolved in order for me to make enough vitamin D. So sunlight exudes energy. How do you make it? It's the precursor of cholesterol in your skin, absorbs ultraviolet radiation, ultimately converting it to vitamin D. But one thing you never have to worry about is you will never become intoxicated with vitamin D from sun exposure, because any excess sun exposure destroys any excess vitamin D in your skin. But it is true, because I'm always asked the question, if you take vitamin D orally compared to exposure to sunlight, is there any difference? There is. The blood level of vitamin D lasts 2 to 3 times longer if you're exposed to sunlight. For humans, the story begins with the Industrial Revolution. These kids in these alleyways in Glasgow, Scotland, developed classic rickets, growth retardation, and skeletal abnormalities. So you realize that now I'm interested in the history of rickets, and I want to get my hands on the earliest prints of Holchinski. So where do you go? National Library didn't have them, or Harvard Library didn't have them, no. But eBay had them, and on eBay, I got the earliest pictures of kids being irradiated. And here is an X-ray, October 1st, 1918. No mineralization of the hand bones and poor epiphyseal plates. Ultraviolet radiation, twice a week for 6 weeks. Marked mineralization of the carpals, restoration of the epiphyseal plates. It was considered to be an infallible cure for rickets back in the 1920s and 30s. In fact, 2 physicians took some children, put them on a roof of New York City Hospital, and demonstrated they could cure rickets. This led to a novel concept. In 1931, our government, as well as governments in Europe, recommended that you put your children outside to get some sensible sun exposure. But this day and age unchallenged for 40 years have been the dermatologists telling you never to be exposed to direct sunlight. In fact, if you ever put your child outside without a sunscreen, at least in the United States, you could America's most wanted for child abuse. Indeed, it was Steenbach in Wisconsin who realized if you can irradiate people and animals, why not irradiate the food? That led to the fortification of milk, not only in the United States, but throughout Europe. And as a result, it eradicated rickets as a health issue. But in the 1950s, as we're aware, there was an outbreak of what they thought was vitamin D intoxication in neonates. Turns out, when you go back into the literature, that was probably not the case, that these were actually rare cases of Williams syndrome that were sensitive to vitamin D. But in any event, laws were put on the books throughout Europe forbidding the fortification of anything with vitamin D, and has caused a resurrection of vitamin D deficiency mainly in Europe, but also in the United States. So vitamin D is essential for bone health. So I thought I'd bring you a couple of cases that you may not typically hear about here. 7-month-old female, muscle weakness, seizures, and a very low blood calcium. And in fact, this is the first time mom in our zoo had given birth to a lowland gorilla called Kermani. And it turns out that the infant is complaining of bone pain. Pediatrician saw the infant, gave the 400 units of vitamin D, didn't do any good, concluded it had a rare genetic disorder, and wished the caretakers good luck. And I got to see this infant. Infant has classic white epiphyseal plates. And so how do you treat it? You treat aggressively. So I gave 5,000 units of vitamin D a day. Infant's feeling great. And in fact, I was a guest of honor for her first birthday. But what's the message here? What is she asking Mom? Mommy, will my growth be stunted? If you go to our zoo and you look at her compared to her sibs, her growth is permanently stunted. We estimate in the United States and probably Europe as well, more than 50% of children are born in a vitamin D deficient or insufficient state. In 1889 in Boston, just very much like in Europe, rickets was incredibly common. More than 80% of children had this disease. Is it a problem today? You better believe it. And indeed, we see about a dozen cases a year, principally children of color. Why? There's this naive concept out there that human breast milk will provide the infant with all of his nutritional requirement. It does not. There's essentially no vitamin D in human breast milk. And so, indeed, if you give your infant sole source, that infant will be D deficient for that period of time. There's only about 25 units in a liter. I don't know what Christina here is thinking about, but I tell you what she should be thinking about. Is she at risk? In fact, we wondered about this, and so I went to our neonatologist. I said, I think your pregnant women are vitamin D deficient. The response was instantaneous. She said, Holick, that's all you're ever thinking about is vitamin D, right? Because our women are taking a prenatal vitamin. They're drinking 2 glasses of milk fortified with vitamin D a day. They can't be vitamin D deficient. So I wound up getting 40 mother-infant pairs, and we measured their vitamin D status at the time they gave birth. Sure enough, taking a multivitamin, drinking 2 glasses of milk a day, 600 units a day, which is what the Institute of Medicine recommends right now for all pregnant women. 76% of moms, 81% of newborns at the time that they gave birth were vitamin D deficient, again, based on the Institute of Medicine's 50 nanomole per liter or 20 nanogram per ml. We're all vitamin D deficient. We went on to show that preeclampsia is associated with vitamin D deficiency. And these are children born in Glasgow, Scotland, by Murdoch Cameron. How? By C-section. Because C-section became popular because women had a deformed pelvis, a difficult time with childbirthing. And so we asked a question, because we also know vitamin D is critically important for muscle function, which is, of course, important for birthing. And we looked at 400 moms giving birth at our hospital and related whether they required a C-section to their vitamin D status, and showed a 400% reduced risk if they simply were vitamin D sufficient at the time that they gave birth. I don't know what Christina here is thinking about, but we're now telling all pregnant women, on top of their prenatal vitamin and taking calcium and vitamin D, they should be taking 1,000 to 2,000 units supplement a day. I think that this tells us evolutionarily how much vitamin D we all need. This is a very nice study by Bruce Hollis and Carol Wagner, where they continue to increase the vitamin D intake in lactating women, asking the question, how much vitamin D do you need to give a lactating woman to satisfy her infant's requirement by putting enough vitamin D in her milk? The answer is 4,000 to 6,000 units a day. Now, you've been taught 100 units or 200 units is all that you need. No. We've probably been off by a factor of 10 for the amount of vitamin D we all require, because our hunter-gatherer forefathers were outside every day making thousands of units of vitamin D a day. Pediatricians have been paranoid about vitamin D intoxication in children, and only recently in the United States, the American Academy of Pediatrics now recommends all children should be getting 400 units of vitamin D a day from the time they are born. And in fact, in Canada, they recommend even up to 800 units a day, especially for infants born at higher latitudes. I think they're getting it right. They're recommending that all pregnant and lactating women, 2,000 units of vitamin D a day. Now, when you would go with a newborn to your family doctor 100 years ago, here even in the UK, the first question that physician would ask the mom is, what is the most common symptom for vitamin D deficiency? It's profuse head sweating at night. And the reason is that vitamin D deficiency causes increase in neuromuscular irritability, and these children sweat at night. Vaginitis has been associated with vitamin D deficiency, especially during the first trimester of pregnancy. So the Institute of Medicine has now come out with its recommendations. During the first year of life, they recommend that children get 400 units. Children above 1 year of age and all adults, 600 units until you're 70 years of age. Then they recommend 800 units of vitamin D a day. But they also conclude this: no need to increase intake for pregnant and lactating women. I think that's a big mistake. Our data are clear on this. 600 units of vitamin D a day will keep a pregnant and lactating woman deficient. Case 2, 1-year-old female, muscle weakness, bony deformities, failures. I don't know if you've heard of this. It's called the Jurassic syndrome. In fact, it's 750,000 young at risk. Now, for those nutrition in the audience, realize lettuce or crickets is not a healthy diet. It's not because of people eating crickets, it's because of iguanas. Because of Jurassic Park, kids want to have a pet dinosaur. What better animal to have than a pet iguana? Well, iguanas are like human beings. They're vertebrates. They need a source of calcium and vitamin D. But they also are herbivores. They love lettuce. 750,000 are importing the United States every year. They're given a steady diet of lettuce. They have no calcium or vitamin D. They wind up with osteoporosis and osteomalacia. And they wind up fracturing their rib cages, their long bones. They fall off their perches, and they die. Well, my 9-year-old daughter went to see Jurassic Park with me, and she wanted a pet iguana. Well, if you keep up with the literature, here, the leptotrial literature, back in 1997, metabolic bone disease, this is what happens when you're vitamin D deficient. Now, I always like the response from the audience, because you show a patient like that, nobody cares, right? But this you'll remember, right? It causes vertebral fractures, right? And it causes long bone fractures, right? And so what do? Well, you have to treat it. How do you treat it? Well, just like for all of you, how do you get your calcium supplement every day? It wouldn't take Tums. It wouldn't take a supplement. It wouldn't drink milk. No. So here's Ramsey. Ramsey's not foaming at the mouth. Ramsey's getting low-fat cream cheese in between a lettuce. There's no vitamin D in low-fat cream cheese. So what to do? Well, they like to be outside because they like to make lots of vitamin D. So you know how industry rises to the occasion when the opportunity is there? And you can do that in the UK as well. You go to a local pet shop, and you could buy Reptisun that mimics sunlight so that your pet reptile at home will make vitamin D in its skin. So there he is smirking at me because I just spent $40 so he can make some vitamin D. Now, we don't do this for our nursing home residents, no, but we do this for our pet iguanas, right? So I have a happy daughter with a happy iguana, right? You need calcium and vitamin D for strong bones and healthy teeth. And when you do that, both my daughter and her iguana grew very well. 25-year-old female, poor dentition, osteoporosis risk factor. If this was a 75-year-old, I'm sure you could easily make the diagnosis, because it turns out that periodontitis is associated with vitamin D deficiency, a major, major health issue, especially for older adults. Case 4, 6-month-old twins, muscle weakness, bony deformities, failure to thrive. I don't know if there are any radiologists in the audience, if you could recognize this animal, but it was a major PR problem in Denver because twin polar bears were born to mom. They could not move. We knew vitamin D deficiency is associated with muscle weakness, and indeed, I was called in as a consultant. We gave these infants some vitamin D, tender love and care, and they're doing great. So I'm an unusual consultant because I consult for Mozuzi in the United States and in Europe. It continues to be a health issue. Institute of Medicine tells you you could get all of your vitamin D from your diet. Vitamin D is rare in foods. That's the problem. Indeed, in the United States, milk is now fortified with vitamin D, and I just came from Dublin, and I know about 7% now of milk in Dublin is being consumed by the population called super milk that's fortified with calcium and vitamin D. So these are good sources of calcium, but you're not getting your vitamin D. In the United States, we get about 100 units, but it's totally inadequate for what we need. Why is it carrying this? Because if you sun-dry mushrooms, and the United States now and in Australia, they realize this is a great way to promote mushroom eating. If you irradiate them with ultraviolet light, they make vitamin D. They're a great source of vitamin D. So in the United States now and Australia, you go to your produce section and you can get UV irradiated mushrooms. But back in the 40s and 50s, right, the kids used to line up, right, for cod liver oil because it tasted so good, right? We don't do this anymore. It comes in tablet, it comes in oil, and it comes in emulsion. And you realize by now that I'm a controversial on my stance on sensible sun exposure, so I'm always interviewed by the press, but then they'll talk to dermatologists. And they say, don't listen to this guy Holick, eat more fish. Well, how much of this stuff do you have to eat? I'll tell you what, it's not a pretty sight. In fact, we went to Guatemala and we went sail fishing, catch and release program. They don't have any. I'll tell you what, nor do roosterfish. No. It turns out it's oily fish only. So cod does not have vitamin D. So you say you eat a lot of fish, it has to be oily fish, salmon, mackerel, herring. In fact, how much do you have to eat? You have to eat it every day. There's only 500 to 1,000 units. But if you're getting farmed fish, it turns out that they essentially have no vitamin D. This is where you get your vitamin D from. Believe it or not, still, it's casual or not so casual exposure to sunlight. Provides most of us with our vitamin D requirement. Out there feeling great, making lots of vitamin D. What about in the wintertime? So I reviewed the literature. Here, the ozone layer shields the rest of the solar system from Earth's harmful effects. Turns out that ozone is very efficient in absorbing ultraviolet radiation. Small amount gets through, and you're making vitamin D. What about in the wintertime? The sun's rays are coming in at a more oblique angle. The question is, can you make any at all? So I got one of my students to go on a roof of an institution in the middle of the month on a cloudless day to measure it. There he is dutifully doing as I asked. And sure enough, in Boston, you could not make any vitamin D from November through February, right? Well, my colleague said, you know, we need evidence-based medicine these days. How like this test tubes up on the roof doesn't cut it. So what to do? So I asked my students, you go on the roof to prove to people you can't make any vitamin D in your skin in the wintertime. After a lot of hemming and hawing, I finally got a volunteer. I'll tell you what, you make no vitamin D in the winter in Boston, all right? But I'll tell you what, if you're like my daughter up in Vermont, you go down to Miami, you can make it year-round. But guess at what latitude? You can't make any vitamin D in your skin. Above Atlanta, Georgia. So you think you're going down to Spain, for example, or Portugal in the wintertime to get some sun and some vitamin D, you make no vitamin D. In fact, in London, right, you will not make any vitamin D from about October through April. You've been taught this. Go out in the sun in the early morning and late afternoon, right? It's less damaging to your skin, and also you're making vitamin D. It turns out it's great for romance, but you only make vitamin D from 10 a.m. to 3 p.m. In fact, early morning and late afternoon is the worst time to go out, believe it or not, because you're getting blasted with UVA radiation. You make no vitamin D. You're increasing skin wrinkling and increasing risk for melanoma. This is what we've been taught about the sun. Excessive exposure will damage your skin, no question about it. It increases risk of non-melanoma skin cancer. Easy to detect, easy to treat, right? People worry these days, of course, about wrinkling, right? And they have now an evolution thinking about beachwear. The two-piece in the 50s, 70s was the one-piece, and new millennium was lots of sunscreen, a lot of clothing. So we asked the question, if you put a sunscreen on with an SPF of 30, how much does it reduce your ability to make vitamin D in your skin by? 99%. right? It's not rocket science. You're exposed to sunlight, making vitamin D. SPF of 30 is supposed to absorb 99%. As a result, you make about 1% vitamin D in your skin. 90 to 95% of your vitamin D is still coming from exposure to sunlight. How much? You never want to burn. You can't look like this. Coming from New England, of course, you can't look like that. But early in evolution, we knew exactly how long to stay outside and go back into the shade, but we lost that ability about 10,000 years ago. So we reviewed the literature, got insight to the problem. So how do you know when you make enough vitamin D? These little poppies used to pop out of your belly button. That doesn't happen anymore. So we did a study, and we put some students in our tanning bed and gave them an oral dose of vitamin D. So if you're out on a beach in a bathing suit and get a light pinkness to your skin 24 hours later, do you know what that's equivalent to ingesting? About 20,000 units of vitamin D. So now you can understand why our hunter-gatherer forefathers outside every day were making thousands of units of vitamin D a day. Our bodies adapted to that requirement. So a couple of hundred units or 400 units in a multivitamin doesn't cut it. It's inadequate to satisfy your requirement. Does sunlight provide you with your vitamin D requirement? It does not matter what your ethnicity. The peak blood levels are always at the end of the summer, and the lowest is always at the end of the winter. Now, he's worried, of course, about aging. In fact, we had shown many years ago a 70-year-old has a 75% reduction in making vitamin D. So he's wondering, can you make any at all? So we did a study. We took some old biddies, wheeled them out on a veranda, and exposed them to sunlight. And sure enough, we could show very nicely even elderly have a capacity to make vitamin D in their skin. And a study done in New Zealand showed, again, 15 or 30 minutes, a couple of times a week, wheeling them out on a veranda, they will make vitamin D in their skin. In fact, here in the UK, Chuck reported back in 2000, if you put UV lamps, just like we do for our pet iguanas, up in a nursing home, that it's the most effective way of maintaining vitamin D status, much better than giving them a multivitamin. If you take a person with a BMI of greater than 30 and you give them the same amount of vitamin D or expose them to stimulated sunlight, they only raise their blood level by 45%. So evidence-based medicine, it turns out when we collected some fat from obese people, they have huge amounts of vitamin D. In fact, we showed that you need, for obese people, at least 2 to 3 times more vitamin D to treat and prevent vitamin D deficiency. So I typically recommend in Boston about 5 to 15 minutes, arms and legs, a couple of times a week, followed by good sun protection, just like what she's doing here. Now, I don't know what he's thinking about, but I tell you what he should have been thinking about. He should have worried about his skin pigment making enough vitamin D. In fact, we showed that Caucasian and African American students exposed to the same amount of stimulated sunlight, African Americans couldn't budge their blood level. 60-fold increase in our white students. They needed 5 to 10 times the exposure to barely raise their blood levels of vitamin D. And that's why Morgan should be concerned. We know people of color are at especially high risk of vitamin D deficiency. We know people of color are at higher risk for having hypertension, heart disease, type 2 diabetes, common cancers. We think that they're associated with their vitamin D deficiency. How do you know your vitamin D status? Well, what you want to measure, of course, is the major circulating form, 25-hydroxyvitamin D. Don't order the active form of vitamin D. It tells you nothing about vitamin D status. So it's the barometer for vitamin D status. Back before 1997, they used to suggest that all you needed was no more than about 25 nanomoles per liter, or 10 nanograms per ml. But actually, docs will only care about is it H, is it N, or is it L. So typically, at the end of the summer, I would get frantic phone calls because the upper limit of about 125 nanomoles per liter, right, if it was above that, they worried if you were in vitamin D intoxicated. I point out to my colleagues, I see a lot of lifeguards in my clinic, right, not so much the Baywatch babes. They're well over 100, which is about 250 nanomoles per liter. Are they vitamin D intoxicated? I don't think so. No. You don't even have to begin to worry about vitamin D intoxication if you're over 150 nanograms per ml, right, which is well over 375 nanomoles per liter. We did a study back in 1998, and what we did was we took that lower limit that everybody thought, about 10 nanograms per ml or 25 nanomoles per liter, and we gave them vitamin D and looked at their parathyroid hormone level and showed that we could show a substantial increase in their 25-hydroxyvitamin D level, but more importantly, the PTH levels continued to decline until they got to about 50 nanomoles per liter or 20 nanograms per ml. So overnight in 1998, when we published a study in Lancet, vitamin D deficiency increased from 25 to 50 nanomoles per liter. So is that enough? Well, it turns out that the PTH levels plateau at around 30 to 40 nanograms per ml, or about 75 to 100 nanomoles per liter. But apparently, especially the Europeans, and here Dr. Roger Bouillon is one of the world's experts coming from Belgium, he said, but there's too much scatter. So we looked at over 100,000 assays performed by Quest and reported this at the endocrine meetings last year. And if you take into account age and sex and break it down, all of a sudden, these plateaus are now very tight. We know that most people need at least 75 nanomoles per liter to maintain their PTH levels in what we consider to be a healthy range. Bob Heaney showed if you increase your vitamin D status, you will increase the efficiency of intestinal calcium transport if you're over 75 nanomoles per liter. And so I like everybody to be at least 75, and certainly up to about 150 to 200 nanomoles per liter is perfectly safe and fine. Bone mineralization defect and vitamin D deficiency, histomorphometric analysis. The Institute of Medicine used this report as a major reason for saying 15 nanomoles per liter is adequate, because this was a study done in Germany. These are motor vehicle accident victims. And what they did was they did bone biopsies and looked to see if they had osteomalacia. And they concluded that you needed 75 nanomoles per liter to have no pathology. Okay. This is the typical normal, and this is osteomalacia. This light pink stuff means that you lay down your collagen, but you can't mineralize it. So that is a sign of vitamin D deficiency. So it turns out that the Institute of Medicine said 97.5% of these people, greater than 50 nanomoles per liter, you don't have to worry about it. But what did he say? The author said 100% at 75 nanomoles per liter. Look at the data. These are their data. This is IOM, tells you to be here. But what do you do with all these people? This is what the authors said. They said that you need to be at least 75 nanomoles per liter to have no evidence of vitamin D deficiency bone disease. So you really have to wonder where the IOM was coming from, suggesting that you owe only 97.5% at 20 or at 50 nanomoles per liter. Is vitamin D deficiency a health issue? What does the Institute of Medicine say? And they say this here as well. No, right? Well, I don't know whether he was on that committee or not, but in any event, is vitamin D deficiency a health problem? No question about it. We did a study in Boston. Again, using 50 nanomoles per liter as a cutoff. 84% of people of color, 42% Hispanic, 30% white. At the end of the summer, vitamin D deficient. Baltimore, Maryland, 54% of community dwellers, less than 25 nanomoles per liter. Unrecognized epidemic in adults over the age of 50. What about young adults? We did a study in our medical students' residents. Many of you in the audience never see the light of day, right? They were taking a multivitamin, drinking 2 glasses of milk a day, 32% deficient at the end of the winter. Bangor, Maine, young white girls, 400-unit multivitamin, 200 units from milk. Are they vitamin D deficient? 48% vitamin D deficient. And who was an author on this paper? Clifford Rosen, one of the members of the Institute of Medicine, right? And we went and followed them in the summertime because they wear sunscreen all the time. 17% came back D deficient, right? And there's the paper, right? Less than 50 nanomoles per liter was observed, okay, in 48% of these subjects. Again, Journal of American Dietetic Association, Cliff Rosen was one of the authors. In Boston, these are teenage children, 52% throughout the year deficient. Pediatrics, from N. Haynes data set, children 1 to 5 years of age, 50% deficient or insufficient. 6 to 11 years of age, 70% deficient or insufficient. D deficiency will precipitate and exacerbate osteoporosis, which is, of course, a silent disease. Holes in your bones does not cause bone pain. But osteomalacia is not so silent. In fact, typically the symptoms are isolated bone pain and generalized bone pain and muscle aches and pains. And this is often the diagnosis that they get, or chronic fatigue syndrome. Most of these patients are D deficient. Most of them have dramatic improvement in their vitamin D levels and improvement in their symptoms if you correct it. This poor woman came in complaining of severe bone pain. She was severely D deficient, corrected her D deficiency, increased her bone density by almost 25% in a few years, free of bone pain and back to work. Also, here at a local hospital in Minnesota, they showed children and adults presented with aches and pains in their bones and muscles, 93% vitamin D deficient. Right? Classic. 23-year-old female shows up with fatigue, back pain, given this wonderful diagnosis of dysthymia, being depressed. on an NSAID and sent home. Asian female, same thing. This black male wound up on a narcotic. He lucked out, sent home. They were all vitamin D deficient. Right? Why do you get pain when you get osteomalacia? We've all learned this. It's called the Jello phenomenon. Collagen matrix that gives rise to your bones. Right? If you take it, it swells. That's what happens underneath your periosteo covering, heavily innervated with sensory fibers. Patients complain of throbbing, aching bone pain. You press on their bone, they wince in pain, you think it's a trigger point. No, it's classic osteomalacia. And so what I typically do is recommend pressing with thumb or forefinger on sternum or anterior tibia. If you wince in pain, I tell you, you probably got osteomalacic bone pain. 78-year-old male shows up with muscle fasciculations, positive EMG, nerve conduction study for ALS. All symptoms resolved, correcting his vitamin D deficiency. It's well known that motor neuron weakness and muscle atrophy that looks like motor neuron disease is improved with vitamin D supplementation. He's constantly complaining to his dog about aches and pains in his bones and muscles. Dog's fed up with him and told him, stupid, you're vitamin D deficient. Right? He's worried about using steroids, didn't have to worry about it, because the higher your 25-hydroxy vitamin D, better is lower extremity function. There's no question that higher dose of vitamin D reduces risk of falls. 72% less falls taking 800 units of vitamin D a day in nursing home residents. Again, this is done in Europe. Sarcopenia is associated with vitamin D deficiency, less than 50 nanomoles per liter. And again, that magical number of about 75 nanomoles per liter, vitamin D predicts physical performance and decline in older persons. You have to wonder what the Institute of Medicine was really reading about. But there's a lot of literature out there to support the 75 nanomole per liter as a minimum for vitamin D sufficiency. Positive association with your vitamin D status, the higher your vitamin D status, higher is your bone density. Vitamin D and calcium prevents hip fractures in women. Best Austin News showed just increasing your vitamin D intake up 700 units a day reduced risk of fracture by as much as 58%. But newsflash, because I know even my wife called me up, because you hear this all the time on TV in terms of getting scientific information. It said that high-dose vitamin D in New Zealand increased risk of fracture. So go back and read the study. It turns out after 31% had increased risk of fracture after 3 months, but it declined to 13% after 9 months. But they didn't take into account that these are elders over the age of 70. They all had osteoporosis. They probably had muscle weakness, weren't feeling great, got vitamin D, and now are feeling wonderful, go outside, fall, and fracture. There, in my opinion, is no evidence to suggest that vitamin D increases risk of fracture. So I like everybody to be of 75 nanomoles per liter, reduce risk of fracture, reduce risk of falling, and therefore less fractures as well. How do you treat D deficiency? Well, that's the problem. You can take a multivitamin, but how many are you going to take? In the United States, you can only take one. There's too much vitamin A, right? Tank is on empty. Do you get a gallon or a liter of gas? You might now because it costs so much, but in the past, you fill it up. So in the United States, we have 50,000 units. I give it once a week for 8 weeks. Fill the tank up. That's 6,000 units a day, right? So it's a nice little green capsule. I tell them to cut it in half sometimes, add it to milk, works well. But the problem is the docs are treating D deficiency, but the patient comes back 6 months later D deficient again because they didn't treat the cause, which was you're not getting enough vitamin D in the first place. So what do? I give basically 3,000 unit equivalent a day, and it works. But you've all been taught vitamin D is one of the most toxic fat-soluble vitamins. He's worried about this as well. So we did a study, and we showed after 6 years on 3,000 units of vitamin D a day that they had about 100 nanomole per liter blood level of 25-hydroxy-D with no toxicity. We think that's what everybody needs, 2,000 to 3,000 units of vitamin D a day for adults. Now, in the United States at least, and that's why King's hair is on end, it's been suggested that vitamin D2 is less effective than vitamin D3. So we did a study, and we took some healthy adults and put them on 1,000 units of D3 or 1,000 units of D2. Placebo, D3, D2, in our experience, no difference. But the issue is that D2 may be destroying D3. And so we looked at the group getting D2, and the D3 levels were no different. But what if you put the two together? So we did that too. At 500 units of D2 plus 500 units of D3, no difference. But what's the message here? We are giving 1,000 units of vitamin D a day to healthy adults. In Boston last winter, essentially no one was vitamin D sufficient. We know 1,000 units of vitamin D a day will not be enough. It turns out, like I said, the one thing I realize when I give these talks that people remember more from their high school days than anything else: don't ever make your patient vitamin D intoxicated, right? They've never seen vitamin D intoxication. They don't even know what vitamin D intoxication is, but these levels sound like they're going to cause vitamin D intoxication. And you're going to be hearing a lot more about this from Dr. Veith this afternoon, but he and we and others have shown you can take up to 10,000 units of vitamin D a day for at least 5 months, not worry about deintoxication. That one morning I get a phone call from a lawyer in Florida, and he said, "Are you Dr. Holick?" And I said, "No." "Why would I want to talk to a lawyer at 7 o'clock in the morning?" He said, "I know you're Holick because you're the only one there at 7 o'clock in the morning." I said, "Well, okay." He said, "Well, I'm going to sue you." Back in the early 90s, I was still promoting, at that time, 2,000 units of vitamin D a day to reduce risk of prostate cancer, but you couldn't get it in your local drugstores. You can't do that here, of course, as well. And so he went on the internet, and he bought this. But it turns out, I told him, before you sue me, send this stuff up, we'll do an analysis for you. The company forgot to dilute it. He was taking 1 million units a day. This will cause deintoxication, right? And in fact, he had a calcium of 15, 20-oxy-D of 500 nanograms per ml. It's difficult to become vitamin D intoxicated. So hopefully, who is at risk? Hopefully I've convinced you by now that everyone is. Just small groups out there, though, especially unenlightened dermatologists, right, that say, why should you care? We were born, we evolved in sunlight. And once you make vitamin D in your skin, like I said, it goes to your liver and kidney to get activated. And guess what? Essentially, every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having a biologic effect? It turns out in 1979, Suda showed if you take leukemic cells that have a vitamin D receptor, incubate them with active vitamin D, they became normal. So vitamin D and the cancer connection, which you'll hear more about in May, and that is evidence for vitamin D deficiency and sunlight deficiency association. Keep up with the literature. Sunbathing can cut your risk of cancer. 1941, it was appreciated. If you lived in Northeast, you are more likely to die of cancer than if you lived down south. The Garland brothers began to show that if you increase your vitamin D intake, you can reduce risk of colorectal cancer by as much as 50%. A study done in Nurses' Health Study at Harvard showed nurses that had the highest intake of vitamin D reduced their risk of getting breast cancer by as much as 50%. What does the IOM say? Read the randomized controlled trials. And what bigger and better study is the Women's Health Initiative, right? And so this was what resulted. Calcium and vitamin D did not cut risk of cancer. There are the data. Look pretty impressive, as of no effect. So I looked at their data, and I sent back a letter to New England Journal pointing out something to the authors that they apparently missed, which is this. Women who took their calcium and vitamin D had no reduction of colorectal cancer. Well, those women that were less than 25 nanomoles per liter and given a normal dose of vitamin D, followed for 8 years, had a 253% higher risk of developing colorectal cancer 8 years later, compared to women that had a blood level above about 60 nanomoles per liter. That should have been the message from that study, right? A study done in Nebraska showed by Bob Heaney, women taking 1,100 units of vitamin D a day reduced risk of all cancers 60%. A study done in Canada showed they called up women who had breast cancer, and they asked the question, how much sun exposure did you have as a young child and young adult? They called up the same number of women that didn't have breast cancer and showed that those women that had the most sun exposure as teenagers and young adults reduced their risk of getting breast cancer by as much as 70% later in life. The possible connection? Well, it turns out, you might argue, well, it makes sense because active vitamin D is an anti-cancer agent. If you increase your vitamin D intake, expose your sun to more sun exposure, you're making more of this active vitamin D. But your kidneys will not activate more vitamin D. And that's a real conundrum. And so it turns out that we and others, Gary Schwartz and David Feldman, among others, and Dan Bickley showed that many tissues and cells in your body activate vitamin D locally. And it's estimated up to 2,000 genes in your body are directly or indirectly regulated by vitamin D. What about the immune system? We've always known activated macrophages activate vitamin D. Have you ever wondered why? All right, it turns out back in the 1840s, cod liver oil was used to treat TB. Vitamin D protects against TB. So in 2006, Maudlin and Adams reported, you infect an immune cell, the macrophage with TB, toll-like receptors get turned on, vitamin D receptors turned on, and then the enzyme to activate vitamin D is turned on. To tell the cell to make a thalassicidin, it's a defensive protein that specifically kills infective agents. right? That's why we think solariums were so effective 100 years ago in helping treat TB. That's why we think people of color at higher risk for TB have more aggressive TB. It also turns out it's critically important for innate immunity. In fact, it's now been suggested here by Feldman in a recent review that there's a whole variety of mechanisms where vitamin D plays a critical role in innate and adapted immunity. Now, the flu season, right? It's upon us. It turns out that it's been always thought maybe due to cold weather. Well, flu virus does not get activated by cold weather. And so it was suggested by Edgar Hope Simpson that there was a seasonal stimulus. And it's curious, at the peak time of your flu season is at the time when your blood levels of 25-hydroxyvitamin D are at their lowest. And so a study was done by another member of the Institute of Medicine. He had given postmenopausal women 2,000 units of vitamin D a day, followed for 1 year, and showed 90% reduced risk of upper respiratory tract infections. Also, 25-hydroxy-D above 38 nanograms per ml over up to 100 nanomoles per liter, right? Twofold reduced risk of viral respiratory tract infections in healthy adults. They were less likely to be sick. They didn't stay out as long, even if they had an upper respiratory tract infection from work. We also know from a nice study done in Japan, if you give school children 1,200 units of vitamin D a day from December through March and looked at influenza A infection, it was reduced by 42%. Also, vitamin D deficiency and type 1 diabetes, very nice study done in Finland by Opponen showed that children that received 2,000 units of vitamin D a day during their first year of life, followed for 31 years, reduced risk of type 1 diabetes by 88%. Look at this. Back in the 1960s, before that, they used to give infants 4,500 units of vitamin D, but worried about deintoxication, they decreased it to 2,000. Here in 75, they decreased it to 1,000. Here in 92, they decreased it to 400. Look at the incidence of type 1 diabetes on the rise. Also, look at this. High prevalence of vitamin D deficiency in children and adolescents with type 1 diabetes, right? Again, 50 nanomoles per liter. 60% were vitamin D deficient. What about the other evidence? We know that the insulin-producing cells have vitamin D receptors, and 125D stimulates insulin production. So it's not a surprise that it's been demonstrated that type 2 diabetes is associated with vitamin D deficiency. 33% reduced risk if you have adequate calcium and vitamin D intake. We also know, again, very nice study from Scragg, from N. Haynes data, diabetes is inversely related to your vitamin D status. We also know relationship of vitamin D deficiency and cardiovascular risk factors, 41,000 patient records, right? Again, less than 30 nanograms per ml, 75 nanomoles per liter, significant association with prevalence for cardiometabolic disorder. We also know that vitamin D deficiency is linked to diabetes and metabolic syndrome. Again, about 40 to 50% reduction in cardiometabolic risk factors. That magical number of about 33 to 35 degrees north, if you live there for the first 10 years of your life, you have a 100% increased risk of developing multiple sclerosis for the rest of your life. A study done in Harvard showed nurses that had the highest intake of vitamin D reduced risk of MS by 41%. Study in Iowa showed women had the highest intake of vitamin D, reduced risk of rheumatoid arthritis 44%. Osteoarthritis has been associated with vitamin D deficiency from the Framingham Heart Study. We also know from Rostand, the higher the latitude that you live, higher is your blood pressure. And it's been demonstrated that magical number of about 75 nanomoles per liter, peripheral vascular disease has been associated with vitamin D deficiency, as has been congestive heart failure. So you may wonder what the mechanism is. It's estimated that 200 genes controlling your cardiovascular health are regulated by vitamin D in reducing risk of atherosclerosis, maintaining your blood pressure, and reducing risk of hypertrophy of your heart. In the circulation, it was published. If you have a vitamin D deficiency, you're 50% higher risk of having a myocardial infarction. And if you have a myocardial infarction and you're vitamin D deficient, you have 100% higher risk of dying of it. Teenagers, I don't know what they're thinking about. They should be thinking about if they are at risk. It's estimated in the United States, 50 million at risk, 2.4-fold higher risk of having high blood pressure, 2.5-fold increased risk of having elevated blood sugar, 4-fold increased risk of having pre-type 2 diabetes. We also did a study with a group in Georgia with Dr. Bin and showed in 49 teenage black boys and girls. And we increased their blood level from about 25 to about 60 nanomoles per liter on 400 units, but we increased it up to 78 to 80 nanomoles per liter, getting 2,000 units of vitamin D a day. Significant decrease in arterial wall stiffness. It's a prelude to both hypertension and atherosclerotic heart disease. So it works at 2,000 units a day. Hypovitaminosis D in developing countries. This is a worldwide epidemic. And if that doesn't get your attention, this might, because all studies have suggested if you increase your vitamin D intake, you are less likely to die. Institute of Medicine is telling you you should never be above 75 nanomoles per liter because they have what's called this J curve, that you now increase, no question, you decrease your risk of mortality. Above about 50, maybe there's an increase. So I went back and looked at the literature that they had used as supporting this. And look at what they said. Risk for mortality levels of 30 to 49 nanograms per ml. So 75 up to 125 to 150 nanomoles per liter, right? Levels were greater than 50 nanograms per ml, may be a higher risk, but only in women, right? What did they conclude? The Institute of Medicine said above 75, increased risk of mortality. That's why I think it's very important for us to be very much aware of our vitamin D status from birth until death. Vitamin D deficiency is the disease of neglect, right? There's a mountain of evidence linking it to these chronic illnesses, which I've talked about. So don't think about a normal level, but a healthy level. We think everybody should be above 75 nanomoles per liter, right? How do you get there? That's the problem, right? For every 100 units you ingest, when you're above 50 nanomoles per liter, you will only increase it by 2.5 nanomoles per liter, right? So if you're in this range, and that's about where you're at, if you're not on a supplement, you really need to be on. I think adults, 2,000 units a day, children, 1,000 units a day. Conquer D deficiency. Best source, Bond bread. They used to fortify it with vitamin D. If you didn't want your kids naked outside every day, you better eat vitamin D fortified Bond bread, right? I know that teenagers, well, especially college kids, of course, would not be D deficient today if they were having this being active. Beer used to be fortified with vitamin D in the United States. If you want to keep sunny energy all winter long, drink vitamin D fortified Schlitz beer. FDA did not take kindly to the nutritional benefit of drinking beer, and they forbid it in 1937. But I went on eBay and I bought a can anyway. Look, Johnny, a Spanish sunshine playing it, New Yorker, 1953, and get your vitamin D, right? So you realize we're not a proponent of sensible sun exposure. So how do you get the message out to the public? So I naively thought, write a book back in 2004. And first page I said, I don't advocate tanning. I did not want to be controversial. And I also point out, no question, excessive exposure to sunlight increases non-melanoma skin cancer risk. But everybody worries these days about melanoma. That's why you're avoiding the sun, right? Guess what? Did you know that most melanomas occur on the least sun-exposed areas? And guess what? Occupational sun exposure decreases your risk for melanoma. That's not what the dermatologists tell you, right? And there are the data. This is what's happened to our sun. It's been demonized for more than 40 years unchallenged, right? Indeed, the slip, slap, slop message in Australia, like I said, 40% of Australians are D deficient. There was just a paper that just came out. Most pregnant women in Australia are now found to be vitamin D deficient, right? Who is this? This is an Australian dermatologist out on vacation at the end of the summer. And guess what they did? They measured their vitamin D status. 87% were less than 50 nanomoles per liter. Right. Vitamin D deficiency has been associated with dementia, right? And indeed, it's been associated with schizophrenia, dementia, and depression. And indeed, data show risk for cognitive decline, marked effect if you're less than about 25 nanomoles per liter. Relative risk, 31%. And the American Academy of Dermatology continues to recommend, and most dermatologists in Europe continue to recommend, you should never be exposed to one direct ray of sunlight for your entire life. You could get it from your diet. You cannot get it from your diet, right? That's what you've been told. You can get it from a healthy diet. You cannot get it from your diet, right? If you are not taking 1,000 units for your children, 2,000 for yourselves, I guarantee you that if you were to measure your vitamin D status, you would find that you were vitamin D deficient or insufficient. I'm always asked, what do? I like to cycle, sunscreen on face, but not on arms and legs. And I, like all my family members, take about 3,000 units a day, blood level about 125 nanomoles per liter. Vitamin D deficiency is probably the most common medical condition in the world. I just came back from Dubai, 90% deficient. Came back from Thailand, from Indonesia. D deficiency is widespread because people are avoiding the sun. There is no vitamin D in the diet. Where are you getting it from? There is no other place. Causes and effects. If you go back to my website, you can pick this New England Journal review. If any one of these chronic illnesses turn out to be associated with vitamin D deficiency, there is no downside to increasing your vitamin D intake. You don't need to be a genius to know. We need vitamin D supplementation and sunlight recommendations. This is not a hypothesis, right? I just wrote recently the vitamin D solution that came out that you can get on Amazon.com. Again, Institute of Medicine recommends 400 for children under the age of 1, 600 children and all adults. Until you get to be 70 years of age, 800 units. Safe upper limit, they've now doubled the upper limit from 2,000 to 4,000 for most children and adults. So even the Institute of Medicine now recognizes vitamin D is not toxic as we once thought. I think easily we should be giving infants at least 600 to 1,000 units a day. Children should be getting 1,000 up to 2,000 units is perfectly fine, especially if they're obese. And adults, teenagers and adults, at least 1,500 to 2,000 units a day. If you're obese, 2 to 3 times more vitamin D. Upper limit, I think easily, the data show, neonates can take 2,000 units a day. Children can easily take 5,000 units a day. And adults can easily take 10,000 units a day for a significant period of time without becoming intoxicated. Don't recommend these levels, but certainly vitamin D is much less toxic than we once thought. Thank you for your kind attention. Happy to answer questions.
Dr. Holick, thank you very much. Any questions and comments from the audience?
Century, Glasgow, and the onset of rickets and so on, is the urbanization. We're seeing Africa and China urbanizing at an astronomical rate, and nobody's reiterating the message that the urban life is the main cause of vitamin D deficiency, and even using the 15-minute coffee breaks during the day, but in the places where there's plenty of sunshine, should be just the simplest solution, but the public health should be getting out of, rather than but it's going back to these old messages.
I agree 100%. I mean, like I said, we really are now avoiding the simplest way to get your vitamin D that costs nothing at all, which is to be exposed to some sunlight. And it's kind of unfortunate that that message has been unchallenged for 40 years. And it is really remarkable how effective parents are in slathering their kids from the time they get up to the time they go to bed with sunscreen, never having them exposed to direct sunlight, which is unfortunate.
Perhaps I'm just new to the area, but I can't but believe why the Institute of Medicine, having all the facts available that you have, would draw just such different conclusions to the way that you've drawn it. And I'll just be interested in your comments.
You know, it's all perspective. I mean, and I think that, you know, it's kind of like a herding kind of instinct. You have like 15 members on this committee, everybody having different ideas. And I guess that what they were concerned about was that they were making recommendations for the population at large, not thinking about all of the other health consequences, and they dismissed all of the other health benefits of vitamin D. I think that that was the major issue. And I really think they made a big mistake by not recommending that pregnant and lactating women increase their vitamin D intake.
I live in Australia, and in New South Wales there's a government advert that is put on, you know, time and time and time again, expressing that there's nothing healthy about a tan.
Right.
And they have this graphic image of melanoma cells spreading through the bloodstream, and Would you like to comment on that, please?
Sure. I mean, and I think that's the problem. It's just like anything else in life, that abstinence, A, doesn't work, and B, is that it often causes more problems than it solves. And as I pointed out, most melanomas occur on the least sun-exposed areas, and occupational sun exposure decreases your risk. It's mainly sun-burning experiences, having red hair, having a large number of moles, and bad genetics are all major risk factors for melanoma, and they never talk about that.
Why would the government spend so much money promoting this idea then?
Because the dermatologists have come up with the big C, and once you mention the word cancer, everybody gets their attention, and that's the problem. And they don't really put it into perspective. They never said that a little bit of sun exposure really doesn't increase your risk of cancer, but rather sun exposure is associated with skin cancer, end of story.
Hello. We use solar meters from America to measure to keep a reading really of the natural vitamin D readings from the sun, just for information purposes, tell our clients. When we get a low level of, say, a reading of 3 IUs per minute based on a 20-year-old in a T-shirt, is that enough UVB from the sun to produce vitamin D at
Right.
that level?
Yeah, I mean, it turns out that because I helped Steve in developing some of these guidelines, is that what often they don't appreciate, it's true that this is how many units you make in your skin, but as I pointed out, when you make it in your skin, it lasts 2 to 3 times longer. So that 3 is really probably about 10. And the more area that you expose, the more vitamin D you're making. And so even that amount of sunlight is still providing you with some vitamin D.
One more question. Thank you.
Could you explain a little bit the link between vitamin D and autism?
Yeah. There's a study, I mean, I know that the Vitamin D Council has now been promoting vitamin D and autism. Autism is so common and vitamin D deficiency is so common that I think it's hard to be able to distinguish the two. There's no question that autistic children should be getting more vitamin D. They're likely to be feeling better because they may not be outside as much. There's only really one study that I'm aware of that kind of maybe implies it, where Somali children living in Minnesota had a higher risk than Somali children living in Somalia. But the conditions are so different that I really have a hard time, really putting those together. So I recommend all children should be getting vitamin D, and that whether or not it improves muscle function and alertness in autistic children, it might under some circumstances, especially if they're D deficient. But whether or not it treats the underlying disease or causes the underlying disease, I think we don't know that.
Thank you very much. Thank you, Michael.